engagement in responding to the pandemic and how to secure such engagement going forward in the future. At the outset, I would like to thank the organizers of this conference and the speakers that we have the opportunity to learn from today. In terms of flow, I will offer some very brief opening remarks. We will then hear from our 4 esteemed panelists, and then we will turn to you, the audience, and participants for questions and interactions. Please note that this session is being recorded and interpretation in English, French, Spanish, and Italian is available. So as we have heard from speakers earlier today and yesterday, governments and institutions worldwide are suffering from crises of trust and legitimacy, scoring lower than in years past across indicators from corruption, transparency, and delivery to overreach and securitization. In this parallel session, we will be unpacking some of the root causes of this lack of trust in public institutions, by and large heightened by the pandemic, and the importance of multi-stakeholder engagement in addressing these crises through effective response and recovery. From participation through e-governance and digital platforms and increasing access to justice, to lessons learned in delivery through partnership and a multi-stakeholder approach, particularly at the local level, and to the immense challenges facing civil society, from civic space to censorship and far worse. Our esteemed panelists will share their specific expertise and angle on how we might improve trust between citizen and state. What are the challenges, solutions, and lessons learned? As has been highlighted by various speakers thus far, and I might also mention in a paper that David Steven and I published for this conference, looking at governance, SDG 16, and COVID-19. This pandemic has struck at a time when the relationship between governments and their citizens and the different sections of society were already under immense pressure. As I'm sure is the case for our audience, I look forward to hearing from our speakers today from their perspectives on how this relationship might be improved and the critical importance of civil society, multi-stakeholder engagement, and a people-centered approach is in rebuilding trust, improving institutions and governance, and providing a safe and open space for participation and engagement as we collectively work and attempt to work to build back better. So with that, I would like to please introduce our first speaker, Ms. Virginia Pardo, Director of the Information Society Area at the National Agency of E-Government and Information and Knowledge from the government of Uruguay. With that, Virginia, please, the floor is yours. Feel free to unmute yourself. Thank you very, very much.
Buenos días a todos. Voy a estar hablando en español, digo por el tema de la traducción, la interpretación. Muchísimas gracias por la invitación a este panel. Y bueno, un poco a la manera de reflexión y de introducción, un poco lo que hablábamos con Margaret ayer. Yo creo que este tema, obviamente el tema de la pandemia es algo que nadie esperaba, y que tampoco estábamos dimensionados, ¿no? como países y como mundo global a todo lo que nos está pasando y por el largo tiempo que también está ocurriendo, ¿no? También no es viable estar dimensionados durante épocas normales a un régimen de pandemia de forma permanente. O sea, que un país esté teletrabajando completamente, que las clases tengan que ser dictadas a distancia, que todas las comunicaciones tengan que ser digitales, ¿no? No hay conectividad, ancho de banda o infraestructura con capacidad para poder hacer esto durante tanto tiempo. Pero sí, creo que lo que sí es viable y debe serlo es tener la solidez y la madurez institucional, la capacidad de trabajo colaborativo como premisa siempre, marcos normativos sólidos, capacidades técnicas instaladas que nos permitan tener capacidad de reacción, ¿no? Rápida, para poder hacer las cosas rápido y bien, ¿no? Creo que eso es parte de las necesidades que todos los países hemos empezado a evaluar y a hacer un diagnóstico de lo que nos pasó. En ese sentido, yo creo que hay un factor clave y que, bueno, en Uruguay, tomando como ejemplo, ¿no? Las cosas que nos pasaron a nosotros y lo que hicimos, y ahora les voy a compartir algunas de las los aspectos que entendemos que fueron bastante destacados, o que por lo menos que sentimos que hubo una reacción importante en ese sentido, es tener una institucionalidad muy fuerte, y estar preparados y dar garantías de continuidad de un montón de cosas, ¿no? De servicios, de derechos, de capacidad de reaccionar rápidamente a este tipo de situaciones, ¿no? Además, hay que sumarle a lo que fue la pandemia, y para poner un poco en contexto, que en Uruguay, el 1 de marzo del año 2020, había cambio de gobierno también, o sea que empezó un nuevo gobierno, y el 13 de marzo fue el primer caso de COVID en Uruguay, con lo cual, además el cambio de gobierno luego de 15 años de un gobierno de otro partido, otra coalición en el país, cosa que es un cambio bastante importante a nivel de autoridades, ¿no? y de roles. Eso nos desafió a tener una gran capacidad de adaptabilidad de todos los actores, y también a capitalizar los avances que el país tenía en los últimos años, ¿no? Tener esa capacidad. Y eso se logra con una institucionalidad fuerte, tener sistemas preparados, tener capacidad de hacer las cosas, de tener respuestas rápidas, tener agencias, en el caso que yo trabajo también en lo que es la Agencia de Gobierno Digital, una agencia transversal que tiene continuidad y que trabajó a lo largo de todo, con todos los organismos juntos, a nivel de gobierno, todo lo que era el sistema integral de salud, o sea, cuando hablamos de sistema de salud integrado, que involucra actores de gobierno, las autoridades del ministerio como órgano rector, pero también los prestadores de salud públicos y privados como un actor ya integrado, y trabajando ya previamente a esta pandemia de forma colaborativa. Sistema educativo, con todo lo que es un sistema maduro a nivel de conectividad, a nivel de acceso a Internet, y bueno, y marcos legales sólidos, vinculados a lo que es garantizar el acceso a la información pública, que eso nos permitió no tener que detener ningún proceso, ningún plazo legal en el marco de la pandemia, que eso es un tema que no fue generalizado capaz que en otros países, y tener normas de protección de datos y de salud que habilitaron implementaciones, siempre con la premisa de la excepción, bajo lo que es la emergencia sanitaria, y respeto de la privacidad, ¿no? Entonces, desde el punto de vista del gobierno, rápidamente se logró articular acciones conjuntas entre lo que es el Ministerio de Salud, Sistema Nacional de Emergencia, que incluye a los gobiernos departamentales y locales, presidencia, los órganos de control, de acceso, de protección de datos, y también unir, que ya estábamos formando parte de una línea de trabajo en ese sentido, todo el ecosistema de otros actores, fuera de lo que era el gobierno, en un ámbito de confianza. A nivel de ejemplos, para darles algunos titulares, nosotros se hizo todo un trabajo muy fuerte, vinculando, junto con el gobierno, el sector privado, vinculado a la salud y a las tecnologías de la información, con todo lo que fue un Plan Nacional Coronavirus, ahí involucrando desde lo que fue la app coronavirus, todo lo que son las aplicaciones para lo que es el rastreo, el seguimiento y el monitoreo de casos, todo lo que son transparencia vinculado al monitor de casos, le llamamos que es el sistema de emergencias, con todo lo que es un monitoreo permanente a la ciudadanía con respecto a lo que son los casos, los contagios, los rastreos, todo un protocolo de canales digitales de comunicación, publicidad y acceso a la información. Y en esa misma línea se está trabajando ahora con lo que es el plan de vacunación, ¿no? Cantidad de vacunados, cuál es el plan, cuál es la estrategia, todo el sistema de agenda. Entonces, eso se logró gracias a una muy buena articulación que ya venía trabajando junta con todo lo que es un ecosistema de salud, todo lo que es, o sea, todo el sistema nacional de salud en Uruguay está integrado a través de las cámaras de salud y además tecnológicamente articulado. O sea, existen todo el tema de la historia clínica electrónica, la telemedicina, que permitió ya rápidamente sentarse sobre la mesa y articular un conjunto de acciones. Y sí, un trabajo muy colaborativo del sector privado, al cual el gobierno estuvo abierto a involucrar, porque esa es nuestra forma de trabajo, articularlo de esa forma. Otro aspecto importante, otro ejemplo concreto también de articulación, y que también, porque ya era una forma bastante natural de trabajo, fue la creación de un grupo asesor científico honorario, el GACH, como le llamamos nosotros. Acá fue un involucramiento clave junto con el gobierno de lo que es el sector académico y la ciencia. Este grupo fue a instancias del gobierno, es un grupo honorario que arrancó en los primeros días de marzo del año pasado y sigue todavía operativo, que su principal objetivo es realizar recomendaciones científicas en el área de salud y ciencia de datos a todos los actores de gobierno que formaban parte, para que ellos tuvieran todos los elementos para las tomas de decisiones. O sea, fue un acompañamiento, es un acompañamiento permanente, están analizando permanentemente las situaciones epidemiológicas del país, y le están haciendo llegar las informaciones al gobierno para que, obviamente, el gobierno tome las decisiones, en muchos casos, políticas o estratégicas con respecto a cómo marcha el tema del país. Es un grupo de más de 50 integrantes, integrado por médicos, científicos, matemáticos, ingenieros, y eso también fue un tema que está funcionando gracias a la cultura que tenemos en nuestro país de involucramiento de gobierno, o sea, la apertura que hubo rápida del gobierno a involucrar a los sectores especializados. Y después otra línea que también se trabajó muy fuerte es, bueno, justamente cómo seguir potenciando el derecho de acceso a la información pública, el tema de accesibilidad, el tema gobierno abierto, con el involucramiento de sociedad civil, colectivos vulnerables y población en general. El tema sí quedó, si bien estábamos muy avanzados, en Uruguay hay mucha conectividad, hay mucho avance a nivel de lo que es acceso a Internet. Diría que prácticamente más del 80% de los hogares tienen conectividad a Internet con banda ancha, casi el 90% de la población en Uruguay accede a Internet a través de celulares móviles. El tema de la accesibilidad sigue siendo un gran debe a nivel de ciertos colectivos, sobre todo colectivos vinculados con lo que es dificultades visuales y auditivas. Lo logramos en el medio de esta pandemia, una aprobación de una ley vinculada a la obligatoriedad de la accesibilidad de los contenidos. ¿No? Se trabajó muy fuerte y se logró mayor involucramiento. Esto ha sido una oportunidad para poner sobre la mesa debilidades que todos teníamos, con todos los colectivos vinculados a ciertas discapacidades. Se empezó a generar contenidos en lengua de señas, lenguaje sencillo. Creo que esto logró generar sensibilidad en muchos de los actores que históricamente estamos pretendiendo que lograran cambios, y esto generó un bronazo importante, ¿no? Con respecto a la ley de acceso, se logró también fortalecer el cumplimiento de la normativa, vinculando a, no se limitó en ningún momento el tema de los plazos. Y bueno, y finalmente el tema de seguir dando continuidad a lo que fueron las audiencias del Poder Judicial, las comisiones en el Parlamento, audiencias por demandas laborales, todo eso se logró tratando de lograr articular con los organismos públicos un buen trabajo con respecto al teletrabajo y herramientas digitales, ¿no? Entonces, hay continuidad de espacios de participación que se lograron. O sea, acá creo que lo importante de la institucionalización, y voy cerrando, es que ya existían espacios creados por ley. Entonces en Uruguay tenemos como más de 1000 espacios identificados, formales, que están institucionalizados, creados desde ámbitos nacionales, locales, con participación de sociedad civil, de forma individual o colectiva, que entonces lo que tratamos durante este periodo fue, no se tuvo la discusión de que tenía que funcionar, ya se partía de la premisa que había que funcionar, sino que pusimos todas las energías con todos los diferentes actores, de cómo lograr que funcionaran por otros canales y de todas las formas posibles, ¿no? O sea, el concepto de esa participación desde el diseño como premisa. Y eso creo que fue parte del esfuerzo y el éxito de poder seguir manteniendo. Obviamente en algunas cosas mucho más lentas, no con la calidad que hubiéramos esperado, pero sí dar continuidad a procesos participativos. Muchas gracias.
Thank you so much, Virginia, for those remarks, and for sharing the experience of Uruguay in terms of how you responded to the various challenges posed by the pandemic, and the creation of new oversight bodies, agencies, and frameworks based on trust, bringing in the private sector, and work that you have done specifically in order to increase, or the government has done in terms of increasing access to services, information, public information campaign, and improvement in the judicial system, with a particular focus as well on those communities that have been more marginalized historically and more likely to be left behind. So with that, I think that's a wonderful segue to then introduce our second speaker, Ms. Sandra Elena, from the Rule of Law, a Rule of Law and Open Government expert within the Ministry of Justice and Human Rights of Argentina. Sandra, with that, the floor is yours, and I thank you in advance for your remarks.
Well, thank you. Good morning and good afternoon for people in different time zones. And thank you for inviting me, for having me here today to share this panel with all of you. I'm going to briefly talk about the challenges of creating more just and peaceful societies through access to justice and how the pandemic has impacted on this. So my focus will be here today to talk how this pandemic impacted the judicial systems and the judicial response that governments and that countries could give to people. Lately, I will discuss some potential solutions to increase access to justice with a particular focus on disadvantaged groups. To this, I would like to put some information in some context. The Task Force on Justice issued a report in 2019, previous to the pandemic, where it calculated that 1.5 billion people in the world have legal conflicts that cannot be solved through the formal justice system. Some of these conflicts are related to labor issues, others to family matters, and also to civil and commercial disputes. This is, as you can imagine, an incredibly high number of people that do not find a way to live in peace. Formal justice systems and dispute resolution mechanisms are failing to deliver an efficient service to an enormous amount of people in the world. The consequences of this, apart from the distress that causes to individuals that live in this situation, is a lack of trust in justice institutions. In Latin America, if you consult the many surveys that every year different organizations publish, only 1 out of 4 people has trust in justice institutions. I think this is the lowest number among all public institutions. The pandemic has only aggravated this situation. The pandemic brought not a health crisis, but also an economic, social, and legal one. The Pathfinders published a document last year that mentions 4 additional burdens that the pandemic brought to the justice system. Now, justice actors face new responsibilities and more workload as they design, implement, and enforce new measures to prevent the spread of the infection. Also, emergency and sometimes hard measures that may impact on civil liberties are implemented. The enforcement of these measures increase the risk of security forces abuse and can undermine trust in public institutions. The pandemic also poses significant risk for people entering the justice system and will reduce the capacity of the system to function. And also the pandemic and responses to the pandemic increase the risk of violence and crime. For example, in my home country, in Argentina, we assessed that violence against women in the context of being stuck at home so many hours a day increased during the last year. So we need to be creative and to look for new solutions to this. So the question is, how should we face all these challenges? Business as usual seems not to be working. I mean, it wasn't working before, and now with the pandemic and all these things that aggravated the situation, we need to be creative and we need to innovate. We need to think in a new approach. And this is a people-centered approach that takes into account the unmet legal needs to overcome the justice gap that I mentioned at the beginning. This requires change in our current worldview. We need an open justice, a justice system that is based in transparency and participation. Justice institutions will only provide an efficient service delivery and therefore help reduce the justice gap if they are open, transparent, and provide quality information and open data widely. Justice open data systems are necessary to reduce the justice gap. Justice systems should also implement participatory frameworks. Only in co-creation with civil society organizations, university, journalists, among many others, judiciaries will understand and correctly address these unmet legal needs. And for people to participate efficiently, they need to have access to information and open data. So in summary, it's time to adopt a people-centered approach that includes an open justice, more access to open data, and all this should be co-created with key stakeholders. So some of these we are implemented in Argentina, some of these solutions were implemented in Argentina. And I have to say that we have already implemented some of these things before the pandemic, so this helped us be prepared when this situation, unexpected and terrible situation, came to our lives. So in 2016, we created the Open Justice Program. We created and maintain an open data portal with relevant primary data that comes from all relevant justice institutions in the country. I think it was the first open data portal in the region. We also developed a participatory platform called Justice 2020 with more than 60,000 active participants that help us co-create our initiatives. We also maintain around 100 centers for access to justice that provided a mix of virtual and in-person legal advice and legal help to people. And now we are provided almost all legal advice virtually. And now, and because of the pandemic, we are also strengthening our virtual platforms, but we didn't create that because of the pandemic. We have been working on this for a long time. We work also with relevant stakeholders in open government workshops to develop a strategy for our next action plan to be delivered to the Open Government Partnership. So we have been working for many years now in different fields, and justice is one of them. We have a workshop on justice that is going on continuously, I would say, just to see what are going to be our next commitments on justice. And as a last example, this week, the Congress of Argentina presented its first Open Congress Action Plan to the community. In summary, a people-centered approach, more data, and public participation will help decrease the justice gap and help gain more trust on justice institutions. We believe that all this will contribute to create more peaceful, fair, and inclusive society. That is the goal that I think we all want. So I'm open to continue this dialogue, and thank you for the invitation again. Thank you.
Thank you so much for those remarks, Ms. Sandra Elena from Argentina, and for highlighting the status quo with trust is quite low in public institutions, as well as in particular justice institutions, but also highlighting the work that you have done through the Open Justice Program, the Open Data Portal, and participatory platforms, including through the Open Government Partnership. Before introducing our next speaker, and again, thanking Sandra for discussing how to possibly close this justice gap through a people-centered approach and increased cooperation, I'd like to remind all speakers, though I'm sure it bears no reminding, that after the initial interventions that each will give, there will be an opportunity for the speakers to then reflect upon each other's remarks, and perhaps during that period, speakers can also offer some concrete examples of participatory response strategies that you have worked on in your response to COVID-19, and how those strategies have benefited from inputs from women, youth, people with disabilities, indigenous populations, and vulnerable groups. So again, after each speaker's intervention, there will be a period where speakers can interact, and then we will take more questions from the virtual floor. So with that note, I would like to now introduce and ask to speak our third speaker, Ms. Michelle Brown, Associate Director of Advocacy with Action Against Hunger. With that, Michelle, thank you in advance, and the floor is yours.
Thank you so much, Margaret, and thanks very much to the previous speakers for their really insightful comments today. So good morning, good afternoon, everyone. I'm really happy to be here today to share Action Against Hunger's perspective on SDG 16 and how it's relevant in our fight against hunger and malnutrition. As an organization fighting global hunger, we are keenly aware of the importance of SDG 16 on all of our work. And particularly, this is more true since the pandemic. For example, if we are to achieve zero hunger, SDG 2, ensure healthcare, SDG 3, and ensure clean water for all, SDG 6, which are really the overarching goals for Action Against Hunger, we need to have inclusive, accountable, and transparent institutions. The COVID pandemic has made it crystal clear that gaps in SDG 16 and in institutions more broadly have made the response to COVID even more challenging. Weak systems have led to greater inequities and far greater numbers of hungry and malnourished people than ever before. And this includes the risk of famine in multiple countries. So COVID has really impacted the work that we do in more than 45 countries, and it's changing how we do our work in 3 ways. So really the overarching transformations that are powering our work, we're changing our focus to more of a system strengthening approach. And this includes partnerships that we're forming with communities, CSOs, and institutions in order to achieve stronger systems. So from day one, we quickly mobilized to become a frontline responder in the pandemic. So we built on our existing work to strengthen water and sanitation and health systems. We're also tackling the secondary impacts of the pandemic, which includes the loss of livelihoods, loss of healthcare, and increased hunger. Much of our advocacy at national, regional, and local levels has focused on the need to ensure equitable access to basic services through responsible, inclusive, and accountable systems. And in this new world of restricted movement and physical distancing, we've adapted our approaches to maintain ongoing health and nutrition programs and are focusing on a system strengthening approach. All of these adjustments have required stronger partnerships at every level, from communities and civil society organizations to community health volunteers to ministries of health. We're changing our approach to partner with communities to support them in advocating for effective, inclusive, and accountable institutions. We want to drive demand for this. The good news is that some of these new ways of working will stay for the future. And this approach is really forming the bedrock of our new 5-year strategy. So let me quickly touch on how each of these 3 ways we're responding and some of the promising examples of partnerships that we're using. So on the COVID prevention side, to keep people healthy, we've ramped up programs that educate communities about hand washing and improving access to clean water. To do this, we've trained countless volunteers inside the community to educate their peers about the importance of this. When COVID hit, many of the international NGOs had to leave. In Mogadishu, Somalia, for example, we were one of the few health actors that remained. All but a few of our staff there and around the world are national staff. We were asked by the Somalia government to help equip and support the country's 3 quarantine hospitals. And we've been playing a role in the vaccine rollout as well. While over 50% of adults in the US have received at least 1 dose of the vaccine, we know that developing countries are the last to receive it. We're now working with the government of Somalia to support them with vaccine logistics, cold chain support, identification of priority groups, particularly vulnerable groups, and more. As vaccines become more accessible in the countries where we work, we'll be relying on our vast community of health volunteers to educate people about the benefits of the vaccine. We're also advocating at multiple levels to ensure vaccine equity and that vaccines are available to our national staff as well as national frontline responders. In many areas, the secondary impacts of the pandemic are far more deadly than the pandemic itself. So we're striving to address the secondary impacts. So a study of the 2014 Ebola outbreak in West Africa underscored that people don't seek basic health care because of the disease. And this resulted in a significant loss of life, not from Ebola itself, but from other health issues. And we're saying the same thing with COVID. Experts have warned that after decades of progress, child mortality is on the rise for the first time in 60 years. In fact, according to some estimates, COVID could push an additional 10 million children into acute malnutrition. And this would lead to a doubling of the numbers of people, along with catastrophic increases in the numbers of people who are at risk of acute food insecurity and famine. So we knew that from day one that ensuring access to life-saving services like hunger treatment is critical during the pandemic. Furthermore, the need for resilient systems has become clear, and strong systems will support people's recovery from the impacts of the pandemic. So we're working on two levels, supporting immediate life-saving assistance and services, but also on longer-term system strengthening. We are adapting our nutrition and health programs to increase community-based outreach. Even as we prevent and treat COVID-19, we need to prevent and treat hunger. Malnutrition is a medical condition that kills thousands every day. We've been doing everything we can, not only to keep our programs going, but to scale them up because the pandemic has left even more people hungry, especially in vulnerable and hard to reach communities. The pandemic has exacerbated these inherent inequities, leaving vulnerable communities even more vulnerable to malnutrition. Necessity has inspired us to adapt. We're testing out new approaches that could lead to lasting improvements in how malnutrition is treated even after the pandemic is over. And this includes expanding access to nutrition services over the long term. I would say one of the best examples of this is our increased focus on community-based care. So it's moving hunger prevention and treatment programs away from hard to access clinics and into communities. So it enables people to access treatment closer to home. This is supporting health systems that are inclusive, accessible, and responsive to people's needs. One of Action Against Hunger's most reliable strategies in fighting both hunger and COVID is to train community health workers. Community health workers visit homes, checking the health of families, and provide treatment for life-threatening illnesses, including malaria, pneumonia, and malnutrition. They also teach caregivers about health, nutrition, and sanitation. The changes these women create in communities and in themselves is remarkable. Beyond the benefits they provide to others, we see women community health workers finding pride in their work, raising their voices, and becoming empowered in their households and broader communities. We rely on community health workers throughout the region to educate the public about COVID via our programs, including through creative radio shows and working with local influencers, such as religious leaders. We work to ensure that excluded communities have access to healthcare. Across the globe, we ensure that groups who are excluded or marginalized because of ethnicity, cultural beliefs, or geography have access to healthcare. And where possible, we invite those groups to be part of the response by asking them to prioritize the issues that matter most, ensuring that their voices are heard. Action Against Hunger works in many fragile and conflict-affected states. Every day, we witness the deadly nexus between COVID, conflict, and hunger. Conflict undermines our ability to access civilians in need of life-saving assistance. A country at war cannot effectively respond to a pandemic or to hunger, and communities in areas of conflict suffer all the more. It's no coincidence that many of the countries on the brink of famine are also facing conflict. In closing, Action Against Hunger is prioritizing community-led activism for strong institutions. We're also prioritizing a system-strengthening approach to ending hunger while we continue to support life-saving interventions. And in short, SDG provides the backbone for all of these efforts. Thank you so much, and I look forward to continuing the discussion.
Thank you so much, Michelle, for those remarks and for highlighting the centrality of SDG 16 and improved institutions and partnerships with CSOs and communities in Action Against Hunger's response to COVID-19, particularly at the local level, and your work in driving demand. I really liked that phrasing, in driving demand for accountable and improved institutions. Also with an eye to the secondary impacts and effects of COVID-19 at the community level. With that, I will in a moment introduce our fourth and final speaker, but wanted to again highlight the fact that so far all speakers have brought their own expertise and their own angle, but all with a focus on collaboration and the importance of multi-stakeholder engagement in a COVID-19 response and in our recovery. From e-government, from access to justice, from service delivery, SDG 16 has formed the backbone, as Michelle said, and basis of these different speakers' responses to the pandemic and in trying to improve lives at all levels. And so with that, there's been a lot of talk of the important role of civil society in this session. And so who better to close to be our final speaker than Mr. Mandeep Tawana, Chief Programs Officer of Civicus. And with that, Mandeep, the floor is yours, and we look forward to hearing from your perspective and your expertise in terms of the role of civil society, different challenges that civil society organizations have faced, as well as solutions in facing this pandemic and response. Thank you. And with that, Mandeep, the floor is yours.
Thank you, Margaret. I want to thank you and DESA and everyone who's been involved in organizing this important conversation. Just before I begin, I do want to appreciate, what the delegates from Argentina and Uruguay have shared, especially in relation to multi-stakeholder and participatory approaches of involving technical experts in conversations around COVID-19 response. And it's also really good to hear from Michelle Brown about how civil society has responded to this really challenging crisis. And, COVID-19 really has disrupted our lives in so many ways, but most importantly, it's exacerbated an existing crisis of inequality, exclusion, and I dare say cruelty around the world. Yet, despite all the challenges that COVID-19 has put forward for us, in our research at Civicus, the Global Civil Society Alliance, we found that civil society organizations engaged with this crisis, as they always do in challenging times, with courage, with ingenuity, and with commitment. In fact, we found that in countries around the world, in Cameroon, for example, civil society organizations worked to distribute hand sanitizers and to distribute information about safety practices in relation to working through the pandemic, especially in the early days when enough information was not available. In South Africa, civil society organizations distributed food and nutrition to elderly people who were isolated at the time of the crisis. In India, when a harsh lockdown was imposed for the first time and hundreds of thousands of migrant workers were left out on the streets, civil society organizations repurposed their work and provided support and shelter and nutrition and basic needs to these people in this time of crisis. Around the world, we found as a pandemic of domestic violence continued to rage due to COVID-19 lockdowns and other emergency measures, civil society organizations around the world provided helplines and other kinds of psychological support to victims during the crisis. So there was a lot that civil society stepped up to the plate in response to this crisis. And here, I mean, the vast response, the vast array of civil society, from traditional NGOs to community-based organizations to movements and so on, who came in response to this crisis. But what I want to really share today is really that, civil society's response happens best in environments where there are enabling conditions for civil society, where the core civic freedoms of peaceful assembly, of association, of expression, which are part of the constitutions of almost every country, which are part of customary international law, are respected. However, global civic space conditions remain really challenging. They were already challenging due to the erosion of democratic values and the rise of authoritarianism and populism in many parts of the world. But the COVID crisis exacerbated these. And three issues are really of importance, which I think is something that we need to focus on a lot more. One is, in the early days of the crisis, we found there was a ramping up of censorship and propaganda. Many governments tried to put their best foot forward. They tried to scrub critical information from different media sources. In some places, informal messages were sent to the media not to report critical information. So people were being denied information upon the basis of which their leaders were taking decisions that could impact their lives. And that remains a serious challenge from censorship that has ramped up due to the COVID-19 crisis. The second issue that I wanted to highlight here is that of overarching surveillance. Of course, COVID-19 response required us to engage in contact tracing. So many governments, put in place measures how to ensure who's infected, who's not infected, what are micro-containment zones, and so on. And many different kinds of technological tools, including apps for this, were put together. But there's a real danger that some of these apps, now that people are getting a handle on these crises, could actually erode privacy. They could also be used to target those who speak truth to power, who expose rights violations, who expose corruption, or who are critical of the government response. So that's something for us to watch for going forward. And the third big challenge happened is in the early days of the crisis, when emergency measures were put in place, when lockdowns were announced. Law enforcement agencies in some parts of the world were given coercive powers to enforce lockdowns, and lethal forces was used in some places. People were subjected to cruel and unusual punishment in some places. So those emergency measures too need to be taken into account, and they need to be discontinued as soon as the emergency ceases to exist. And for us in civil society, an enabling environment and enabling civic spaces are extremely important for civil society, not only to perform its service delivery roles or its policy making roles, but also to perform its accountability roles. Nevertheless, I did want to reflect on a few good examples of civil society participation and governments engaging with civil society as partners in the spirit of Goal 17 of the Sustainable Development Goals. And here I just wanted to mention that in Sierra Leone, there was a presidential platform that was established where civil society members were asked to come and give inputs. In Malawi, a ministerial task force was set up where civil society was again able to provide inputs. In Austria, within the government COVID-19 response stimulus package, civil society was recognized, allocations were made for civil society. Within that, in Netherlands and other places, donations to civil society to engage and address the crisis there were tax exemptions and other measures introduced. So governments did support civil society in performing its roles during these times. And civil society in itself also responded by exercising the right to peaceful assembly in many places around the world where government's responses were lacking or governments needed to do much more. Public mobilizations were also organized around the world through innovative means such as putting shoes in public places by civil society or crosses in front of government buildings where the death toll has been quite high. And those are important mobilizations that continue to happen. And I just want to end with recognizing how public mobilizations can really motivate change around the world. And in fact, in Chile, there's been public mobilizations in inequality in society for a long time. Those public mobilizations led to a call for a constitutional referendum, and as a new constitution is being established, also one of the things that that civil society was able to work through with government was a commitment to have gender parity in the commission that will set up the new constitution. So there's a lot here where civil society can offer in relation to COVID-19 responses, in relation to Sustainable Development Goals fulfillment, but we need effective and enabled civic spaces to be able to do that. Thank you.
Great. Thank you so much, Mandeep, for those comments and for highlighting the importance of enabling conditions for civil society in COVID-19 response and recovery, highlighting challenges around censorship and propaganda, emergency measures, and how tools such as apps can then be used to, in fact, violate privacy. But then also highlighting good practices from Sierra Leone, Malawi, Austria, and Chile. Very much appreciated. So with that, I'd like to again thank all the speakers for their interventions and remarks. Again, highlighting the importance of a participatory and multi-stakeholder approach in responding to and recovering from COVID-19. At this point, if there are speakers who would like to comment on each other's remarks, whether it has to do with open justice, access to information, service delivery at the local level, or partnership, the role of civil society in addressing all challenges posed by COVID-19, I would actually offer and ask the speakers to go ahead and do so. While secondly highlighting the question that came in from UNDESA, asking the speakers to provide some concrete examples of participatory response strategies offered in response to COVID-19, and if and how these strategies concretely benefited from inputs from women, youth, people with disabilities, indigenous populations, and vulnerable groups. So speakers, please use this time to interact with each other and each other's comments, and also feel free to provide some more concrete examples of participatory responses. As this is a new approach, are there any speakers that would like to kick this off? Please just go ahead and unmute yourself. And okay, so Virginia, I see your hand just was physically up. Okay. So please, Virginia, go ahead. Thank you.
¿Voy? Uy, cortito. No, un poco, digo, buenísimo, la verdad, placer haber escuchado las exposiciones de los colegas del panel, que creo que cada uno con diferente óptica, pero que todos como que poniendo énfasis siempre, ¿no?, en aspectos relevantes y claves que se repiten y que son consistentes, ¿no? El tema de la necesidad de la transparencia, el acceso a información certera, oportuna, el acceso a datos que sean objetivos, ¿no?, para todos los diferentes sectores, y el tema de la participación con un involucramiento en un ámbito de confianza, ¿no? Creo que eso que es parte de lo que creo que todos, si bien de diferentes países podíamos ya tener algunos espacios más o menos avanzados en eso, este año nos puso en prueba, ¿no? Fue como un reto para todos de cómo lograr realmente llevarlo adelante. En particular, un poco también siguiendo la línea de lo que decía Sandra, Elena también, el tema de la transparencia, la información clara. Nosotros hay temas vinculados, por ejemplo, el tema del acceso y la disponibilidad de información para que realmente no haya dificultades de entendimiento y conocimiento por parte de la población en general, ¿no? O sea, ese creo que también fue, o sea, como que vivimos en Uruguay diferentes niveles de conocimiento de las cosas, ¿no? Y de participación. Está el nivel científico, está el nivel académico, está el nivel de gobierno, o sea, no toda la población tiene la capacidad de entender y aprender y para involucrarse de la misma manera por un tema hasta de conocimiento y de grado de conocer los temas, ¿no? Hubo mucho debate creo en todo el mundo, pero en Uruguay también, el tema de vacunarse o no vacunarse, los efectos que podía tener, el tema también de, bueno, los cuidados, el tema de los riesgos que hay con respecto a la enfermedad. O sea, comenzó al principio del año cuando empezó la pandemia, pensando que era algo muy leve, que no era grave, ¿no? Después fue cambiando, ¿no? Y todo eso, y cómo llegarla a las poblaciones hasta en los lugares alejados, donde no tienen tanto conocimiento o nivel educativo que pueda llegar a tomar la capacidad de decisiones críticas, ¿no? Y poder acertar. Entonces eso es un desafío muy importante. Entonces el tema de la información para mí fue fundamental. Por ejemplo, con respecto, como les decía, hubo un caso ahora, digo, cómo es clave informar bien y de forma certera y con todos los actores, ¿no? O sea, creo que parte de lo estratégico acá, el grado de participación y compromiso de todos es las diferentes voces que puedan dar información certera y concreta y accesible ver bien. O sea, en el último tiempo que en el Uruguay hubo una discusión vinculada a lo que era o sea, que pasó en todo el mundo, de los problemas de saturación del sistema sanitario, ¿no? O sea, las dificultades que había con respecto el sistema sanitario a nivel de lo que puede ser las camas en los sistemas de centros de tratamiento intensivo, ¿no? El lugar donde se tiene que estar alojadas las personas en el sistema sanitario que están con cuidados intensivos graves, ¿no? Entonces una discusión, cuestionamiento de si realmente estaba saturado o no saturado el sistema de salud en Uruguay. ¿Ah? Y eso rápidamente a nivel de gobierno, a nivel de prestadores de salud privado, a nivel también de actores del sindicato médico, pusieron sobre la mesa datos. O sea, se resolvió la discusión en 2 minutos cuando se transparentó, y ahí un poco va la línea de lo que decía Sandra, datos abiertos y un monitor diciendo, bueno, esta es la situación actual del sistema sanitario a nivel de camas, disponibilidad, y a nivel de cómo está funcionando, qué tan saturado está o no. O sea, eso también creo que es importante, esa forma de decir, bueno, transmitir información certera y concreta, como que es parte de una necesidad, parte de la confianza en decir, bueno, estoy diciendo, no es un discurso político, no es un discurso científico, no, es la realidad, así está funcionando, y eso creo que da tranquilidad a todos los actores. Y otro ejemplo, bueno, respecto a lo que es las poblaciones vulnerables, un poco comentaba al principio con el tema, obviamente tuvimos que todos irnos a lo digital, en muchos casos, tuvimos que estar encerrados en nuestras casas, y era la forma. Es más, le pedíamos a nuestra población, no te traslades, no vayas presencial a una oficina a hacer un servicio, no vayas presencial a hacer una consulta, porque la idea era tratar de cuidarse, quedarte en casa, fue la consigna durante todo un año, en la medida que pudieras, y entonces se puso en evidencia un montón de colectivos que se aumentó la brecha. ¿no? Entonces hubo un montón de colectivos donde la dificultad de lo digital no accesible fue clave, no solo para entender y estar informados y poder conocer la información básica, sino para trabajar. O sea, entonces se tuvieron muchas reuniones y mucha participación, y aumentó muchísimo, y eso creo que es por eso que es una muy buena oportunidad, colectivos vinculados a asociaciones de discapacidad, que se contactaron mucho más específicamente que antes era capaz que no era tan fuerte el nexo con el Estado, para plantear especialmente sus prioridades y sus necesidades. O sea, teletrabajadores del Estado, por ejemplo, que tenían que quedarse en su casa y tenían dificultades para acceder a las herramientas, y los que tenían con dificultades de cierta discapacidad no podían trabajar. Entonces creo que hay un tema también de seguir manteniendo la inserción laboral, de seguir manteniendo las capacidades de todas las personas como para poder trabajar, y eso también nos ayudó a escuchar, nos ayudó a priorizar y a definir y a tomar medidas muy fuertes, por lo menos del gobierno, generó una reacción muy fuerte en cambiar la forma como estamos trabajando y presentando información a todos los colectivos. Eso creo que es algo que nos pareció como algo importante. Y eso creo que de vuelta, un poco como lo decía al final, el involucramiento y la participación de todos los colectivos es fundamental. O sea, para generar esa confianza, o sea, para lograr esa ponderación permanente que estuvimos haciendo de derechos, de prioridades, de demandas, de medidas, o sea, poner sobre la mesa temas tan prioritarios como la salud, pero también la situación económica, o sea, temas de progreso, temas de decir, bueno, ¿qué priorizo? ¿El trabajo, a la salud? ¿O qué priorizo con respecto a el acceso a la población de ciertos servicios básicos? ¿no? Entonces eso, la seguridad, como se comentaba al principio, en Uruguay también hubo temas vinculados a aumentos potenciales de violencia de género por estar confinados y encerrados en las casas, ¿no? Ese tipo de cosas son problemas que se fueron visualizando y que se tenían que ir atacando de diferente manera. Un ejemplo también que se visualizó y que se está empezando a monitorear y que en el marco del 5º plan se está poniendo sobre la mesa para potenciar, es el tema que se visualizaron bajas en las denuncias de lavado de activos en el tema de anticorrupción. O sea, empezaron a bajar. Entonces, por un tema de no capacidad de hacerlas presencialmente, que muchas veces se hacían en esos contextos, la gente no se animaba a hacerlo por medios digitales. Entonces, bueno, se está estudiando, se puso sobre la mesa el desafío de cambiar el sistema de denuncias para, contra el lavado de activos, para que no baje ese avance que había tenido en el país. Entonces, todo eso creo que nos ha movido y nos está desafiando a seguir fortaleciendo y mejorando más los procesos de una forma colaborativa, que es clave, ¿no? Creo que eso es fundamental.
Well, thank you for letting me know many things that you're working on, and illustrating with examples. I am particularly concerned on these side effects of the pandemic. As I said, the pandemic is mainly a health crisis, but I think that now we should consider all other crises at the same level. Because Michelle said something very, very, that touched me a lot, very deeply, that child mortality is the highest in 60 years. And this is really unacceptable. Mandeep talked about the abuses of police and the potential violations of human rights. And actually I saw something similar going on here in Latin America. And then Virginia talked about how little claims against money laundering there are in Uruguay. So there are so many aspects that we need to take into account that no government can do it alone. I mean, this is so many things together, and how disruptive this pandemic is, that we have to work together, because we cannot address all these issues at the same time. But as important as not getting COVID is not getting malnutrition in children. So, and this needs to be prioritized in a way by the society as a whole, governments, civil society organizations, the people that are directly impacted by these decisions. If, for example, in Argentina, we have a very long lockdown, and this caused a very deep and difficult impact for people that loses their jobs, and people not having their employment anymore. So actually it's like a humanitarian crisis, I would say. And the government alone cannot solve this, because government can, of course, mediate among different interests, but this is such a huge disruption that the whole society needs to be called upon and listened to. So this is what we are trying to do, and by offering these different channels and these different platforms, not only in terms of access to justice, but for example, we put a lot of information related to quantity of COVID cases and beds in hospital, as Virginia said. We also put in open for data formats a lot of information. So now we have some people in civil society working with this data, so people can be informed all the time, and governments are so concentrated dealing with the pandemic itself that we need help from civil society. And this is what we are experiencing now. No, we open up data, and we know that we can rely on some organizations that work with this data and translate that raw data in something that is more accessible to all. So now we are trying to do the same with vaccines. People are reluctant, some of them, of getting vaccinated, not as much as we anticipated, but still we need to generate some confidence and trust among the population. And we are getting a lot of help from civil society organizations, health organizations that are very strong in Argentina. So we have to work with the scientific community, but not only with the scientific community. We need to also to work with community-based organizations, because they also know what the priorities for their specific communities are, and we have to listen to them, because we in government, from our offices, we maybe not understand exactly their priorities. So this is why it's so important that we all get together and we understand what the others and the communities need. As an example, schools are also to be included in this conversation. We did not have children going to school for a very long time here in Argentina, and of course there is a demand for quality education, so we have to work with parents, with children, with schools to try to reach an agreement on and a balance between the measures against the pandemic, but also getting quality education for our children. So I think that my message would be, the government cannot solve this problem alone. We need to hear those voices, we need to understand their interests, and we need to work together to reach more fair and more just solutions. Thank you.
Thank you so much, Sandra, for those impassioned remarks and for commenting on the other speakers' interventions. I would also encourage all the speakers to feel free to include links to the different programs that you're mentioning in the chat box for all of those that are participating in this session. It will just be easy for them to just kind of go ahead and click to see what it is specifically that you are speaking to and about. And I think Michelle and Mandeep also want to reflect on what has been said by colleagues, and but I just would like to reiterate and kind of highlight, Sandra, your point about that governments can't do this alone, and that civil society engagement, participation, and meaningful partnership is fundamental and absolutely critical to any type of recovery that is in any way sustainable. So with that, I know, Michelle, I see you've unmuted yourself. So please, Michelle, go ahead, and I will mute myself.
Great, thanks. And thanks to all the speakers for the really, really engaging comments. I would say overall, just on the civic space issue, we're finding it increasingly difficult in some contexts where we operate to continue to deliver impartial humanitarian assistance based on humanitarian principles. So humanitarian space in many of these contexts, exacerbated by COVID, is shrinking. So just to echo a bit what Mandeep was saying, but I would say one issue that's emerged quite strongly in our engagement around the COVID response is just this really focused attention on equity. And of course, we've all heard about equity for the past years, but I think now the inequities that have been laid bare by COVID are really front and center. And I think we have an opportunity now to continue to push for inclusive institutions that really address the inequities that are across the globe. I think in every country, we've seen that COVID has had differentiated impacts on different groups of people. I would also say that there is, at least in kind of the humanitarian and development space, a growing recognition of the really critical importance of local actors. So they've been on the front line, often with very little support. They've provided the support, they have saved the lives, and they've often done it alone. And I think going forward, it's incumbent on all of us to push for increased support, increased protection, increased funding for these local actors, because they've shown that they can be really effective, more effective than governments in many cases. The gaps in the government response have really raised the key role of civil society and the need to support civil society, has been stated by all of the other speakers. What an interesting piece that we have seen is really an increased public mobilization for our issues. We're seeing increased solidarity with affected populations. So, groups of citizens in Kenya have come together and raised money for the COVID response, addressing the gaps in the response, gaps that the government is unable to fill. And we're seeing that in many of the countries that we operate in. So there is, I think, a recognition that, we're kind of all in this together. And we as citizens have a role to play in filling the gaps that government is unable to provide. Just kind of on the advocacy side, members of parliament have become some of our most important champions around food security and nutrition. We've seen that some MPs have really stepped forward to push for increased investments in nutrition and health. And that had always been the case, but I think now, given that we're seeing the increased secondary impacts of COVID, some MPs have become more mobilized around this. Also with journalists, we've been working quite closely with journalists to highlight some of these growing inequities, the need to invest in health systems, food systems, and we're getting quite good results on that front. Just kind of on the participatory, how we've engaged in participatory processes. I mean, I think probably the best example was the one I gave around community-based treatment of acute malnutrition. So in our consultations with caregivers, who are predominantly women, the feedback we were getting is that it is very difficult for them to take their malnourished kids to health facilities, which are often very far away. I mean, if you look at many countries, people live, hundreds of kilometers away from formal health facilities, and it takes them sometimes days to travel to these health facilities. So we heard from them that they need treatment that's in their community, that's easily accessible. We have trained many women to be able to detect malnutrition. It's just a simple band that they use to put around the arm of their child, and that can detect malnutrition before it becomes severe. And it really is creating a demand for health services that are accessible to them, that do not force them to spend all of their money to travel, and health systems that are responsive to their needs. So during that process, they also learn about their rights. They have a right to health. They learn about the commitments that their governments have made. Their government has committed to the SDGs, for example. And so it generates this demand for improved services. We're also working at community level to lead advocacy movements to access improved services. So in terms of health, in terms of water governance, for example, so working with communities, community-based organizations, and local authorities who often in decentralized contexts have quite a bit of influence over how money is spent. So we work with communities to learn about budgeting, for example. And that's been a really effective tool to increase funding for many of the programs that we support. Thanks.
Thank you so much. Thank you, Michelle, for those remarks. And I also, maybe for a kind of a final, as part of a final round of comments from the speakers, after Mandeep reflects on what's been said, I think it'd be interesting if people could also talk about budgets, budget lines, and how that type of investment in participatory approaches can actually be seen in how money is spent. Thank you again for those, for your remarks, Michelle. And with that, Mandeep, I know there was a specific question for you, and I'm sure you'd also like to kind of reflect on what's been said.
So thanks, Margaret. And one, it's really good to hear, Virginia emphasizing the importance of internet and, and having open access. And I think that is absolutely critical for people to have information about government responses, about data, to be able for us to have a holistic and people-centric response to any issue. So I think I was really, very heartened to hear that, and also for Sandra to to emphasize that governments cannot do it alone, and governments need to work with civil society, and we can be in creative tension, and which is good, I think, and we can also work in cooperation at different times, and I think that's really critical to be able to do that, and just and the important part, what I think Michelle dwelt on one thing is, our societies are very diverse, and within every society, there are people who are oftentimes excluded because maybe they don't figure in the political calculation of the government of the day. They may be historically disadvantaged. There may be other reasons why they are, sometimes away from the developmental discourse because they live in a remote geographical area. And here it's really important that governments recognize the value of civil society in creating inclusive and participatory governance, and that's really is going to be important as we try to rebuild a more just, a more fair, a more sustainable world post COVID-19. One of the questions that came to me in the chat was that of the good examples, what was it right that these public institutions did? And I think that question has been very well answered by Virginia and Sandra. And but I would just say that the good examples that we heard from Argentina and Uruguay need to be replicated in many different parts of the world. And unfortunately, according to our research at Civicus, global civic space conditions are not very good. 87% of the world's population live in countries where there are very serious restrictions on the freedom of peaceful assembly, association, and expression. In many parts of the world, speaking truth to power can land you in prison. We work within our own networks with prisoners of conscience, people who, because of what they do, or because of their defense of constitutional rights, have been subjected to politically motivated prosecutions and so on. So I think I would just say civil society organizations need to be provided enabling legislation, and civil society activists need to be provided strong in rule of law environments. So investments in rule of law are going to be critical if we want to create equal and sustainable and just societies as promised in Agenda 2030, and to have democratic institutions. I have a few more points, but I can bring them in the end around people-centered multilateralism and about a new paradigm of development that goes beyond the old MDG approach and focuses on the rights-based underpinnings of the Sustainable Development Goals agenda.
Great, thank you. Thank you so much, Mandeep. And yes, there will be a chance to provide kind of closing statements before I close at 1:05 Eastern Time. But before doing so, I'd like to bring out some additional questions that we received through the registration process. And I will pose these to you, our esteemed speakers. And just for those who would like to respond, please do so. So I will, taking advantage of my role as moderator, I will highlight again my question around budget lines, because I think where money is spent indicates where priorities are. And so if any of our speakers have examples of how budget lines have been, from local to national levels, how budget lines have been adjusted during the pandemic and in response and recovery from the pandemic in order to actually sustain a more multi-stakeholder, more inclusive approach, participatory approach to public decision-making, to service delivery, et cetera. So an example of how that commitment has actually been translated and then implemented through shifts in budgetary lines. That's just a specific question from my end. And then in terms of additional questions that have been posed by those who have registered for this session, I think perhaps similarly, if there are any good practices that any of the speakers could highlight around how to sustain mobilization of different groups throughout the recovery and then post-recovery. I know many of us can't really imagine post-recovery at this point, but to ensure that the different participatory approaches that have been kind of instituted and implemented, drawing on different expertise from different communities, including perhaps from the scientific community, but also community-based organizations, can then be actually sustained, whether through legislation, through other means. Please, so with those two questions, we'd love to hear more from speakers in your expertise. If anybody wants to speak first, just raise your hand. Okay, I could also call on you. Okay, thank you. Sandra, go ahead.
Well, I'm not an expert on budget issues at all, so I'm not going to give a technical answer to this, but what we've done in Argentina, yes, we reallocated funds into specific issues. One is getting vaccines, so this was, I think, the priority. And the second one was to provide mitigation funds for those who lost their employments and who were suffering the most. So I cannot give you the figures because I really don't know them, but in general terms, I can say that yes, we reallocated funds due to the pandemic, and these were in these two directions: for health, for vaccines, and for mitigating the issue. Of course, this caused a lot of tension in the system because Argentina is in an economic crisis right now, and we have some problems like inflation, but we considered that these two things were a priority. So we reallocated funds for this. And to your second question, more than an example that we can find many, I would tell you about my experience, not only in Argentina, because I work in helping public organizations in many other Latin American countries. And I think that sustainability of civil society participation is a challenge and has been a challenge for a long time. And in my experience, you need to formalize spaces for and with systematic mechanisms for public participation. When you call upon meetings, but you don't have a clear framework for that participation, the most likely is that you cannot get a sustainable participation. So for what I've seen, you need like a systematic approach and a formal mechanism, not a law necessarily, but like a regulation where you set all your participatory system, and it's a written, a formal piece of paper where you can find different measures and different approaches to this participation. What has been worked well for us was the participation through the open government workshops. So I would advise that scheme. But of course, this also depends to being part of an international organization. So, but just to copy the good practices, the best practices of that system could work for making participation sustainable. But I agree that this is a challenge.
Thank you, Sandra. Yeah, Michelle, go ahead.
So just to complement what Sandra said, I would say the sustainability of civil society mobilization is an issue that we confront every day. But I do think that one thing that we do see happening more and more in the countries where we work is the transfer of our power as international NGOs to local civil society. And I think that in and of itself is a huge step towards sustainability. Local ownership and local capacity are far more sustainable than what we as international NGOs can do. Secondly, on the kind of budget line advocacy that we do, I mean, I would say for Action Against Hunger, this is one of the biggest areas of our national level advocacy. If something is funded, if nutrition is funded, for example, by governments, it is already progress towards more effective institutions. I mean, if the governments are able to allocate money to meet the needs of their citizens, it makes our job much easier. We can then hopefully leave one day. So most of our budget advocacy is done through multi-stakeholder processes. So for example, on the nutrition side, you have the Scaling Up Nutrition movement. And that is a grouping of international NGOs, UN, national NGOs, CBOs, private sector, government. So, I mean, across the board. And that we have found to be one of the most impactful ways to influence budget allocation at national level. And it's on a number of fronts. So nutrition financing, reproductive health, water sanitation, food systems. I mean, as Sandra mentioned, many countries are facing severe budget constraints. Tax revenues are down. Foreign assistance is down in many contexts. So for the most part, you know, we're just pushing kind of a defensive line, don't cut funding. In the case of Somalia, we did get a small increase, advocating through this multi-stakeholder platform. So, I mean, it's possible, but I think, you know, in the coming years, until the global economy improves, it's going to be very difficult to get additional funding for some of these programs.
Great. Thank you. Thank you so much, Michelle, for that. And okay, Virginia, please, some comments. And we are going to try to end it at 1:05. So around 1:03, 1:04, I will offer some very brief closing remarks. So if anybody else would like to say something, please, this would be the time to do so. But with that, first, Virginia, to you, and then to Mandeep. Thank you.
No, bien breve, creo que ya se ha dicho todo y realmente comparto muchísimo, fue un panel muy con ricos aportes. Creo que un poco siguiendo los últimos comentarios asociados a las últimas preguntas, y que un poco fue lo que dije al principio en mi introducción, el tema de la institucionalidad, la formalización de los espacios, para dar esa sostenibilidad es clave. O sea, nosotros en Uruguay, cuando empezamos con todo el tema de poner el gobierno abierto sobre la mesa como un proceso y un cambio cultural importante ya desde el 2011, nos subimos a un montón de espacios participativos que ya existían. O sea, eso fue parte de una decisión hasta consensuada con todos los actores de sociedad civil cuando nos sentábamos en las mesas de diálogo. No había que inventar nuevos espacios, sino capitalizar y potenciar los existentes, ¿no? O sea, que estaban formalizados, que tienen reglas claras. Acá es fundamental para todos los actores que participan, sea gobierno, sociedad civil, academia, sector privado, saber en qué está participando, para qué está participando y cuáles son las expectativas y la forma de en qué está aportando y qué no, en qué funciona. Eso es fundamental en todo sentido, porque si no va generando hasta falta de confianza en los procesos, en si es vinculante o no es vinculante, cuál es el grado de incidencia de la participación, hasta dónde puede incidir en esa participación, si no. Eso para mí es fundamental y eso tiene que estar, como decían anteriormente compañeros, documentado, claro, no necesariamente es una ley, puede ser una norma, puede ser un documento, o sea, pero tiene que estar claro entre todos los actores como algo para que dé sostenibilidad. Eso para mí es fundamental para la sostenibilidad en el tiempo. Y para justamente lograr esa confianza, ¿no? Eso creo que es fundamental. Si no, los actores van generando instancias paralelas, hay descredibilidad en el proceso, y eso creo que es fundamental en todos los sentidos para justamente pensar en futuro. Creo que esta pandemia nos puso la oportunidad de, en el caso de Uruguay en particular, ya existían un montón de ámbitos creados, o sea, la necesidad de la formalización no estaba, pero sí faltaban actores en la mesa. O sea, hubo una sensibilización muy grande en este proceso de lograr mucho más actores de sociedad civil, mucho más actores de la ciencia, de la academia. El sector académico particularmente estaba bastante alejado de los procesos de gobierno abierto, y con esto como que se llegó a la mesa. El Parlamento, por ejemplo, el Poder Judicial, o sea, logró esa movilización de otros actores que capaz que estaban tan cómodos o todavía bastante alejados a lo que es la participación en ámbitos de incidencia. Y eso creo que hay que aprovecharlo y capitalizarlo. Y eso creo que es un deber de todos también. Ese es un poco el mensaje que me parece que me gustaría que nos quedara.
Thank you. Thank you so much, Virginia. And yes, now Mandeep, over to you, please.
So, Margaret, I'll be brief. You asked about budgets, and many countries have put in place some sort of stimulus package which provides a certain degree of protection to those who are at the bottom. But yesterday, the President of the United States made a historic speech, I would say, something that really shows a very empathetic response from the government. In fact, there were commitments on protecting the American family, there were commitments on childcare, there were commitments on minimum wages, of enhancing that. And more importantly, there was a commitment of raising funds from billionaires who have profited through this crisis. So, and as it was highlighted in the speech, about 650 billionaires have made a huge amount of money from the crisis, and there needs to be a commitment to progressive taxation so as social protection schemes and social investments can be paid for. So that's one example which perhaps we can continue to look for and see in the coming days how that's going to pan out. But overall, there needs to be a reorientation of budgets from the wasteful expenditure that is spent on militarization. The 5 members of the Security Council, whose responsibility is to promote peace and security, also produce and spend a lot of money on weapons of war and also on proliferation of weapons of war. I dare say that money could be better spent on the Sustainable Development Goals commitments on peace and justice, on gender justice, on equality, and on environmental sustainability. So that's something for us to keep in mind. But there are many governments around the world that spend a lot of money on military expenditures, and maybe COVID-19 can be a moment for us to reorient from that towards making sure that people's rights and are upheld and they have a good standard of living. Lastly, I would just like to emphasize that this really is a moment of introspection around the world. The United Nations has celebrated 75 years of its existence last year, and what the COVID-19 pandemic has taught us is that global challenges, whether they are pandemics or whether they are migration or whether they are climate catastrophes, they very easily move from one place to another. And our response to them needs to be through a multilateral approach. And unfortunately, this multilateral approach has been stymied through aggressive nationalism, whether it's reflected through vaccine nationalism or whether it's been reflected through aid and trade restrictions. So there I would say is we really need to work together in the spirit of international cooperation. And international cooperation needs to be centered in a rights-based approach in the spirit of the UN Charter. And international and multilateral cooperation cannot just be about trade and commercial sustainability or certainty, but it also needs to be about protecting fundamental freedoms and the basic principles enshrined in the Universal Declaration of Human Rights. Thank you.
Great. Well, I would like to, again, thank all the speakers so much for the expertise that they shared, the experience, solutions, challenges, very briefly highlight some of the kind of themes that have really resonated through our discussion today around the need for a rights-based approach, the need to formalize and institutionalize, to understand the priorities of communities by going to the local level and empowering the local level. I think, as Michelle said, transferring power to local actors. The critical importance of protecting and preserving space so that if people speak truth to power, as Mandeep said, they don't land in unfortunate circumstances or jail. The importance of champions, the importance of truthful information, as we are all battling misinformation across contexts in the context of COVID, and the importance of looking at secondary effects of the pandemic on various communities and doing what we can to reduce the justice gap in response and recovery. And of course, foundational to all of this is, again, building trust, figuring out ways to build trust between citizens and citizen and state, and the critical role of civil society through that process, and issues and kind of investments in social protection, dialogue and participation, and then the drivers of mistrust, for example, corruption. So with that very brief and just kind of long list of the different points that have been raised, I would like to again very much thank the speakers for their incredible interventions during this session, and thank you to those that have shared links in the chat box. And thank you to the organizers. And just to again highlight that this session and its main messages will be included, will be kind of wrapped up by the organizers and shared online in due course. So with that, thank you all, and very best to everyone else for the rest of the conference. And I hope we all continue to stay tuned in. Thank you, and bye-bye.